Good day, I am Dr. Smith, a neurologist. Thank you for staying with me for a full and careful session. Our shared purpose is to protect your strength, your balance, your words, and your memories by learning to hear what your legs are telling you before the brain cries out. I will move at a calm pace and I will use clear language. I will explain why the legs speak first, how to notice the early signals, what to do at home, what to expect in the clinic, and how daily choices shape your risk across weeks, months, and years. I will also offer stories, simple routines, and short scripts you can speak out loud in a real moment so that doing the right thing becomes easy. Let us begin with the big picture. Your legs live at the far end of the circulation. Blood travels a long road away from the heart and then must climb back against gravity. When the lining of the arteries is injured by long-standing high blood pressure, by diabetes, by tobacco smoke, by abnormal cholesterol, by kidney disease, or by sleep apnea, the body lays down plaque and the wall becomes inflamed. That process is called atherosclerosis. Because the legs are far from the heart, the earliest slowdowns often appear in the leg arteries before they appear in the brain. Doctors call that pattern peripheral artery disease. The same roots feed both peripheral artery disease and stroke. This is why a new change in the legs can act like a smoke alarm outside the door to the brain. Now let us define what a stroke is in plain language. In an ischemic stroke, a clot blocks a brain artery. The brain cells that depend on that artery lose oxygen and begin to fail within minutes. The result depends on the location. One person may have weakness in one arm or one leg. Another may slur words, lose words, or speak clearly but struggle to understand. Someone may lose vision in one eye. Another may feel a sudden pull to one side or a heavy stagger. Clots may form on unstable plaque in the neck arteries called the carotid arteries. Clots may also form in the heart when the top chambers quiver in a rhythm called atrial fibrillation. The same biology that harms leg arteries harms brain arteries. That is why leg clues matter. Here is the golden rule that guides all urgent decisions. If any new neurological symptom begins suddenly, such as face droop, weakness or numbness on one side, trouble speaking or trouble understanding, loss of vision in one eye, or a thunderclap headache, treat it as an emergency and call for help right away. Minutes save brain cells. Minutes preserve walking. Minutes keep words and names and plans safe. With that rule in mind, we will walk through the 7 major leg warnings. I will give you the reason behind each warning, a short story to make it real, and a simple action step you can follow today. First, sudden weakness in one leg. Imagine rising from a chair and the leg seems to vanish for a heartbeat. Not from fatigue, not from a long day, but from a sharp change that arrives out of the blue. The reason is under perfusion of the motor pathways in the brain. Action step, sit to prevent a fall. Note the exact time of the very first change and seek urgent evaluation. A patient of mine felt his right leg give way on a morning walk. He came the same day. A tight neck artery was treated. A larger event was prevented. Second, numbness or tingling in one leg that does not change with posture. People describe a thick sock feeling or a soft foam feeling under the foot. Back-related nerve pain often changes with bending or sitting. Sensory loss from reduced brain blood flow does not respect posture. It feels the same when sitting, standing, or lying down. Action step, ask for same-day evaluation. A patient in her 70s felt a left foot buzz every evening. Testing showed a vascular pattern we could treat. The buzz faded with care. Third, a dragging foot or a new scuffing on the front of one's shoe. Often a partner hears it first on a hallway floor. The toes catch because the muscles that lift the foot are not receiving crisp signals. Small strokes along the motor pathway can cause this change. Action step, record a short walking clip in good light and bring both shoes so we can examine the wear pattern. A single front edge worn thin is a quiet but important clue. Fourth, repeated tripping or falling on familiar ground. When the cerebellum or the sensory pathways are undersupplied, the map of where the foot is in space becomes fuzzy. People misjudge a stair they have climbed for years, or catch a toe on a familiar threshold. Falls are not just bruises. Falls bring fractures, hospital stays, and a long shadow of fear. Action step, keep a simple fall log with the date, the surface, the shoes, the time of day, and any medicines that lower pressure or cause sedation. Patterns in that log help us remove risks and target treatment. Fifth, a new resting tremor, or brief jerks in one leg. When blood flow to deep movement circuits wobbles, the balance of signals tips and the leg may move on its own. Action step, schedule prompt assessment. Review medicines that influence movement and obtain imaging if needed. A gentleman told me his right calf danced during evening reading for a week. That clue led us to a vascular issue we could treat. The movement stopped. Sixth, imbalance or a gentle pull to one side, often worse in the morning. The cerebellum is sensitive to small drops in flow. Mild overnight dehydration and low morning pressure can unmask a borderline supply. Action step, drink water on waking, measure pressure sitting and standing. Note whether you lean the same way each day, and seek care if imbalance lasts beyond a few minutes or returns over several days. We will look for a correctable narrowing, for rhythm problems that lower pressure, and for medicine effects that we can adjust. Seventh, brief symptoms that fully resolve, called transient ischemic attacks. A vanishing symptom is not a relief. It is a siren. The risk of a major stroke rises over the following days and weeks. Action step, same-day emergency evaluation. Not tomorrow, not after a weekend, the same day. You can screen yourself at home with safe and simple steps. Stand near a counter for stability. Sit in a firm chair, fold your arms, and stand up and sit down 3 times without using your hands. Notice knee buckling or a clear left to right difference. Then stand near the counter, close your eyes, and hold steady for 30 seconds with your fingertips close to the surface. Strong leaning is not normal. Next, gently touch the inner and outer soles of both feet with a clean cotton tip and compare sensation inside and outside, left and right. Then walk 10 heel-to-toe steps along a straight line. If you veer or step off repeatedly, write it down. Place a small note on a calendar so that patterns become easy to see. Now let us look at what happens in the clinic. We measure an ankle-to-arm pressure ratio called the ankle brachial index. A low value points toward peripheral artery disease. A very high value can suggest stiff calcified vessels. We often add Doppler ultrasound to map blood flow in the leg arteries and in the neck arteries. When choices depend on precise anatomy, we use computed angiography or magnetic resonance angiography. Because clots can begin in the heart, we obtain an electrocardiogram and sometimes a wearable monitor to look for atrial fibrillation over several days. These tools let us match the therapy to the cause. Prevention lives in your daily rhythms. Here is a practical plan. For blood pressure, use a well-fitting home cuff. Sit quietly for a few minutes. Measure in the morning and in the evening for 1 week. Bring the average to your appointment so we can tailor your plan. For diabetes, even a modest weight change improves insulin sensitivity and lowers risk. For cholesterol, healthy food helps, yet medicines that stabilize plaque are often necessary and life-saving. For movement, aim for brisk walking on most days. Add short balance practice such as sit to stand, heel to toe walking along a line, and gentle calf raises while holding a counter. For tobacco, stopping is the single strongest lever for slowing peripheral artery disease. For sleep, if you snore or stop breathing, ask for a sleep study, because treating sleep apnea smooths pressure swings and improves oxygen delivery. For alcohol, keep intake low. For medicines, take antiplatelet therapy and statin therapy as prescribed, and do not stop without speaking to your clinician. Let us build a daily and weekly rhythm that fits real life. Morning, drink water, check a pressure value, and take a slow lap through your home to notice any lean or scuff. Midday, stand from a chair 5 times without using your hands, and note any difference between sides. Evening, practice a short line walk and a gentle foot sensation check. Twice each week, add a longer walk outdoors if weather allows, or walk laps indoors. Once each week, review your notes, refill medicines, and prepare a question for your next visit. This rhythm is not a burden. It is a quiet investment that grows. Caregivers and family are partners. Here is your list. Watch for a new lean to one side. Listen for a scuff that repeats on a single foot. Notice hesitations on the last stair. Tune in to a change in word clarity or a pause that suggests a search for words. Do not debate whether the change is real. Agree to call the clinic and ask for earlier review. Place important numbers where everyone can see them. Offer to join the short daily walk. Help with the line walk practice. Your steady support moves the timeline from later to now. Common questions deserve clear answers. Is every calf pain a sign of peripheral artery disease? No. Joints and tendons also cause pain. The classic sign of peripheral artery disease is cramping after a predictable walking distance that eases with rest. Should I go to the hospital if my symptom went away? Yes, when the episode was sudden and one-sided. A transient ischemic attack is a forecast of danger and deserves same-day care. Am I too old to benefit from treatment? No. Risk reduction helps at every age. The aim is not only longer life, but steadier steps and safer days. Are home screens safe if I fear falling? Yes, when done near a counter with a family member nearby, and when you stop at the first hint of unsteadiness. Will medicines hurt my liver or my muscles? We monitor carefully. If a side effect appears, we adjust the dose or change the agent. The long-term benefit of plaque stabilization and clot prevention is large for people at risk. Mindset matters. Fear can freeze action. The goal of this session is not fear, it is agency. You can measure, you can record, you can improve, celebrate small wins, a steady line walk, a week of complete medicine adherence, a morning with no scuff. Share those wins with family. When families walk together, risk falls for everyone. Home safety deserves attention. Check shoes for uneven wear. Replace shoes that slip on glossy floors. Place non-slip mats where you stand often. Clear thresholds that catch toes. Improve light along your hallway path to the bathroom. Use a nightlight so the route stays visible. These steps prevent falls while we solve the medical side. Travel brings special challenges. On a long car ride or a long flight, make a plan to stand, stretch, and hydrate at regular intervals. Wear supportive shoes that you have already broken in. Pack medicines in a small bag that stays with you. Set a simple reminder for doses. Learn the local emergency number and keep it on a card. Share your plan with your travel partner so that early action is never delayed by uncertainty. Now let me share a set of extended stories that anchor these lessons in real life. A retired teacher who loved gardens heard a faint scrape from her right shoe each morning and felt a short spell of numbness in the right foot while trimming roses. She remembered a talk like this one and came the same day. Imaging showed a tight carotid narrowing. We treated it. Her walking steadied. She returned to long park paths with her grandchildren. She now keeps a small calendar by the door and marks a single letter for each daily action. She says the calendar is her quiet coach. Another story runs differently. A man in his late 60s noticed left leg weakness that came and went. He told himself it was age and that it would pass. Weeks later, he fell on the porch and fractured a hip. During recovery, he suffered a larger stroke. He worked with courage in rehabilitation and regained much of his function. He told me he wished he had acted at the first clue. The gap between these two stories is not fate. It is attention and timing. Because this is a long teaching, let us gather everything into a final roadmap that you can carry in your mind. The legs are an early alarm because they live at the far end of the circulation. The 7-leg warnings are sudden weakness in one leg, numbness or tingling that does not change with posture, dragging or scuffing of one foot, repeated trips on familiar ground, a new resting tremor or jerks, imbalance or a pull to one side, especially in the morning, and brief episodes that vanish, which are transient ischemic attacks. The golden rule is that sudden change is an emergency. The home screen includes a chair stand, a balance hold with eyes closed, a gentle foot sensation check, and a short line walk. The clinic uses an ankle to arm pressure ratio, ultrasound mapping, advanced vessel imaging when needed, and heart rhythm monitoring when clots from the heart are possible. Prevention grows from daily choices, steady walking, balanced meals, careful sleep, freedom from tobacco, and medicine adherence. Caregivers serve as steady eyes, ears, and voices for timely action. Before we close, here are short scripts you can speak in the moment. If you feel sudden one-sided weakness, say, "I am having a sudden change." Please call for help now. If a family member hears a new scuff, say, "I noticed a new sound. Let us call the clinic together." If you feel brief numbness that vanishes, say, "It went away, but we will treat it as a warning. Let us go today." Clear words shorten delay. Shorter delay saves function. I am grateful for your careful attention. Your legs often speak before your brain cries out. They speak through weakness, through numbness, through tripping, through scuffing, through tremor, through imbalance, and through brief episodes that come and go. By listening early and acting quickly, you protect your independence, your relationships, and your memories. Share this message with someone close to you. Invite them for a gentle walk today. Keep your notes, keep your appointments, keep your confidence. Thank you for listening, and please take very good care of your legs and your brain.